Welcome to our first annual Mercy Grayling video. Our intention is for you to quickly get an overview of all we have accomplished together in providing great care to our communities in 2012. You'll hear about our top performance and quality of care, how we give back to our community in the form of care to the poor and services to the broader community, our focus on recruiting high-quality physicians and mid-level providers who want to care for patients right here in northern Michigan, our special partnership with our auxiliary volunteers, the perspective of a key donor with a family legacy of giving, and the journey of our nursing service and ongoing professional development. At Mercy Grayling, we are known for the exceptional care we provide through the relationships we establish in all aspects of the work we do. We care for our family, our friends, and our neighbors, and once a patient has had the Mercy experience, we are given the opportunity to become their trusted health partners for life. The Sisters of Mercy began their legacy in 1911, and we continue our mission of serving together in the spirit of the gospel to heal body, mind, and spirit, to improve the health of our communities, and to steward the resources entrusted to us. I'm very proud of the work we accomplished this past year, and I'm hoping you'll feel the same as you watch this video.
It has always been part of our mission to help those in need, the poor and the most vulnerable in our communities. Community benefit encompasses all of the activities and programs that we provide at Mercy Hospital Grayling in the treatment and promotion of health and healing to our community. In fiscal year 12, we donated over $3.7 million to our communities in programs and services and served more than 66,000 individuals. How we measure community benefit is divided into three categories: charity care, those living in poverty, and programs for the broader community. Key initiatives include our medication access program, chronic disease management and education, diabetes education, physician network clinics, and the Asabo-free clinic. We also completed a community health needs assessment in June. For the next 3 years, we will focus on needs that have been identified through this assessment as strategic priorities for our communities. These needs, called Tier 1 needs, include access to primary care, advocacy for substance abuse and mental health services, chronic disease management, maternal and child health, obesity prevention, and programs and advocacy for the uninsured. We have already begun implementing programs to meet our Tier 1 goals and have partnered with several county collaborative groups to increase our impact. We will continue to fulfill our mission, working in our communities, listening to them, and partnering with them to improve the health of those we serve.
I've been volunteering at Mercy Hospital just shy of 20 years. I started volunteering here at Mercy after receiving excellent care here at the hospital. I continue to volunteer at Mercy because it's part of my life. I enjoy the people I work with, the work I do, the fellowship with the other volunteers, and I feel like maybe I'm making a little bit of difference with what I do. My favorite part, I think, is just the social part of it and the work that I do. I've worked in many of the areas and know a good many of the people, and I just like it. It's part of my family.
I moved north and began working in Mercy's emergency department in 1994. Initially, I enjoyed the fast-paced, ever-changing environment of the ER and the great group of people I worked with. The longer I worked at Mercy, the more I appreciated the focus on customer service and making a connection with the patients. I especially admired the Mercy values of justice and commitment to serving the poor. After more than 17 years in the emergency department, I chose to further my education and become a nurse practitioner to focus more on making those patient connections. I decided to stay with the Mercy system because I'm able to incorporate the Mercy values into my patient interactions every day. Becoming a member of the Mercy Physician Network has allowed me to fulfill my passion of caring for patients and providing care close to home.
Perinatal patient safety was a key quality initiative with which we've had success in fiscal year 12. As part of our involvement in this initiative, all eligible nurses and physicians were required to take the National Certification Corporation Fetal Monitoring Exam. I'm pleased to report that all eligible nurses and physicians successfully completed and passed the exam. Value-based purchasing was another significant quality initiative. Starting October 2012, the Centers for Medicare and Medicaid will take away 1% of our Medicare dollars, and we will have the option to earn back this money in a pay-for-performance program called value-based purchasing. The value-based purchasing program is split into 70% clinical quality measures and 30% patient satisfaction scores. The clinical quality measures that were chosen by CMS are included in the clinical quality measures that we collect for the Trinity Health measurement system. We collect and send data to Trinity on a monthly basis that measures clinical processes, patient safety, patient satisfaction, nurse turnover, and regulatory scores. Our scores have been in the top 5 out of 29 hospitals for the past 4 years. Moving forward, we will continue our work in current Trinity Health and other Michigan quality programs like Keystone, while also concentrating on the management of chronic diseases such as diabetes and heart failure. Additionally, we will focus on bridging the work that is done in the hospital with the work that is done in our physician network offices. Patient safety remains our #1 priority, and we will continue our work to provide the highest quality, safest environment for our patients.
Since the release of the Institute of Medicine's report called The Future of Nursing, Mercy Hospital Grayling has been striving to achieve the recommendations from this report. One such recommendation is to increase the percentage of bachelor's prepared nurses to 80% of our nursing workforce. Currently, approximately 30% of our nurses have a bachelor's degree. Many nurses are engaged in learning. We have 36 nurses enrolled in bachelor's or master's degree programs, and we are supporting their efforts through tuition reimbursement, scholarships, partnerships with nursing schools, leadership development, use of grants for online educational resources, and nursing research. As a small community hospital, we are making big strides to ensure excellence in nursing practice.
I've been donating to Mercy Hospital Grayling since 2004. Well, we moved up north from the Detroit area to Houghton Lake with our family, and we had used the facilities many times. We knew by the caliber of these people and the dedication that given them new equipment, given the right updated systems, that they would go with it and make it the success it is today. We continue to donate to Mercy Hospital Grayling. We use the facility ourselves, but however, the needs in northern Michigan are so great, and to stay competitive and keep people not having to travel, we continue to help the hospital to do upgrades, upgrade systems and equipment where we can.
Healthcare is experiencing unprecedented and rapid changes as we transition from a fee-for-service environment to one based on cost and quality. We're planning on being here to continue to serve the healthcare needs of our communities, and together we will shape the plans that will take us where we need to go for a successful future. I am grateful that you have chosen to share your gifts and talents with Mercy. You have made us what we have become, and you will allow us to deliver exceptional healthcare services into the future by caring and connecting with the people we serve. Thank you for your dedication and commitment to the mission and values of Mercy.